Okay, you gotta look alive.
Okay. Watch these ones.
Yeah. So we are 1 day out from surgery, and Laura had surgery yesterday and had a facelift, brow lift, lower eyelid restoration, corner lip lift, chin augmentation, fat transfer, and then kind of lasering of her whole face and neck and chest. And she's doing great. What we look for on the first day is making sure that there is no blood under the skin flaps. That's like the first thing that we're looking for. Making sure the patient we feel like all their nerves are working, and most of the time they are. There are instances where a nerve can be a little weak. It's nothing to worry about. That can happen after the surgery. But everything is checking out totally fine. And then we just want to check in and see how their nausea is, making sure that they ate overnight, go over post-op instructions, and then get them into the recovery protocol.
Yeah.
Going okay?
I'm going to my hyperbaric chamber dive right now. I'm very excited.
Yeah. Okay, great.
Okay.
You know how you really hate this shadow right here?
Mm-hmm.
So I put some fat kind of in two different parallel directions to help build that up. And then we did the stronger laser on your eyes, and then the UltraClear laser everywhere else.
Great.
Yeah.
Okay.
Headache is okay?
So far, so good.
Amazing. Yeah. You're a trooper.
One of the reasons that I did choose this practice was because of the recovery suite of options and package. Knowing that I would be able to come to one place, have my sutures cleaned, have the same team that did all the work on me, looking after me, and then I just walk right down the hall into that hyperbaric chamber. I got here this morning, and my procedure was last night, and asked, hey, would it benefit me to have an IV? And they said, sure. So I was able to get an IV, which I know will help me feel better. And that's my focus right now. I know I can't really look at my phone or, do emails and things that I would normally do, but what I can do is everything focused on my recovery. So IVs, hyperbaric chamber, just anything extra that I can do.
Really beautiful neck and jawline. I think you're going to be like super stoked with the chin.
Mm-hmm.
Went with a really, it's a small size and just the right shape to give a little teeny bit of projection and shape.
Right.
Okay. But it's going to look like really natural.
Oh, I don't think I've seen that for many, many years.
Yeah.
It's
So
just there. Yeah.
you can see with me, right?
Mm-hmm.
So, you've got swelling obviously in every
Sure,
component,
sure.
but this is just going to create that littlest bit of definition, which is going to look good, not just here, but also like here.
Yeah.
And then you see, so you've got all this shadowing that's not only here, but it comes all the way and wraps around here, and that's going to just be a really pretty.
Wow. Great.
Yeah.
It's nice to see. Kind of.
Yeah, and obviously this is today and tomorrow. The next day are your puppiest days.
Yeah.
So you have these funny sutures right here on both sides.
Okay.
Those are called netting sutures. They kind of just keep the skin down, especially if someone's at a slightly higher risk of bleeding.
Okay. And when I feel super like it's hard to talk and breathe, will it continue?
So
that?
a lot of like that really tight feeling, usually you turn a corner somewhere around day 4 or 5.
Okay.